The first step that we need to do when we're building up these teeth that are diminutive in size is we have to build the subgingival emergence profile. I want to make sure that the composite is emerging subgingivally so I can create the natural contour of the tooth and not just be abrupt, working at the papilla height and coming out on an angle. So I'd like to use small matrix bands. We'll be doing this in the hands-on exercise. This happens to be a plastic contoured matrix band, but metal bands, as you'll see during the hands-on, that works perfectly well. I like using the plastic bands for demonstration so you can see the material. I'm going to use just a small amount of composite. It's just less than a pea size amount. We'll show that during the hands-on. I'm going to take this very small amount. I'm going to use a very fine instrument. This is my IPC instrument. And I'm going to tuck the composite up underneath the band, and the band is being supported in the subcervical position under the soft tissue. So the band is resting up against the root surface, and then the composite then is being able to be placed underneath there, and it has a band that is holding it in positions in the subgingival area. It's important that you take your time with this and you make sure that this is as smooth as you can. You'll want to look from the palatal or from the lingual to make sure that it's nice and blended in. And very often, as I show you during the hands-on, I need to support the palatal of the band to make sure that it's a nice smooth contour and there isn't any ledging that creates from building up this first subgingival contour. With this first layer, I'm not concerned about getting a proximal contact. It's really just about creating the subgingival emergence profile using some sort of contoured matrix band to create the subgingival emergence profile, not concerned about getting a proximal contact at this point. All right, when you have your composite or your compule, I want you to squeeze out the first little bit, and I want you to discard that. The first little bit of composite in these compules is a little over oxygenated, and so it's not as doesn't blend as smoothly. So then I want you to just squeeze out a little bit of material. You don't need much at all. We're going to hardly use any composite at all. And then I'm going to put my composite back in the warmer. And I'm going to take my very thin instrument. This is the IPC. This is from Cosmonet. And I'm going to take off just a tiny portion of that. Just this tiny amount. I'm going to clean my gloved finger with an alcohol gauze. And then I'm going to roll that little piece into a little ball. It doesn't seem like very much, but this is all we're going to need to use to support that subgingival emergence profile. I'm going to cover that to protect it while I get the matrix band in place. All right, once we have our matrix in position, then I'm going to take my composite, the tip of my thin instrument, again this is that IPC instrument. I'm going to place this material, and I want to blend this. Again, the matrix band is sealing at the cervical. That's a critical part, and I'm using my forefinger on my non-dominant hand. And again, I only want that composite to support that subgingival emergence profile. It does not need, and it shouldn't, go up towards that proximal. I don't want to build a proximal wall at this point. We'll be using the putty matrix to help us do that. So at this point I want to make sure that this is blended in smoothly. Again, it's only a couple millimeters tall, nowhere near towards creating the contact. And again, this is just to establish that subgingival emergence profile. If I need, I can support the matrix band with an instrument while my dental assistant cures. And what you also want to do is come in with your instrument and try and seal off to the lingual. Get that as sealed as possible. But we're going to come back and do that in a second because we're going to just do a brief cure. I'm going to cure this for just a few seconds. Just for about 3 to 5 seconds. That's going to harden the material towards the front of the matrix band, but now I can relax my finger, and I can come back and I can evaluate the palatal and make sure that that's nice and smooth. We can do that with the matrix band on, or we can remove the matrix band in the mouth. So in this case, we'll remove the matrix band so that we can inspect The composite will still be somewhat soft on that lingual. We'll be very careful as we're lifting that off. So come in with your IPC or your thin instrument and then just blend along the lingual. And coming back to the facial. And now we can see how our cervical margin now is at about the height of the papilla, which is what I'm looking for, because then now I can freehand the rest of the composite. So let's cure from the lingual and from the facial to make sure that that composite is completely hardened.